My name is Adi Penyaganda. I am a social studies teacher at Apple Valley High School, and today I want to encourage parents across the state of Minnesota to get your kids vaccinated as soon as possible against COVID-19.
Teaching through this pandemic has been quite a challenge.
I work with a lot of young children who aren't eligible for vaccines yet, so I really would like to encourage adults and older children to get vaccinated to keep our children safe.
If we want to have a chance at a normal school year, we need to create classrooms that are safe and buildings where students don't have to worry about their health.
The vaccination will allow us to move back into our building with more safety, less risk, and overall less fear.
The school year starts in just a few weeks, and the COVID vaccine, as we all know, takes a couple of weeks to get to that fully effective state. So they'll be fully protected by the time the school year starts.
And I encourage all students to get vaccinated as soon as possible so that we can have a great school year in 2021.
Have a great year. Much success to all educators out there. Much success to all young people out there. Let's make it happen.
Hello, everyone. Welcome to the Global Fatherhood Foundation. Indeed, today we're talking about COVID-19 Delta variant. It's a discussion, a community discussion and engagement, and we are also going to have some education on the risk factors. So please, if you join the conversation, do me a favor, invite your friends, and let us have a conversation. I believe there is a situation where we all want some understanding into the whole Delta variant, even as people and communities began to feel some hope, or at least cautious optimism late this summer that the pandemic has receded to the background. There was still the threat, like I mentioned, that new mutations of the COVID-19 virus could bring it back, explode, and it might even get stronger. Are people still dying? These are the questions that we want to find answers to. And our communities worrying. Indeed, communities are very worried at this moment. Significant worry in our communities right now, like I mentioned, is the Delta, a highly contagious SARS-CoV-2 virus strain, which was first identified, if we remember, in India somewhere in December. It indeed swept rapidly through that country, and lots of people unfortunately died. And also in Great Britain before it reached the United States, where it is now the predominant variant. According to the Center for Disease Control and Prevention, that is the CDC, the highest spread of cases and severe outcomes is happening in places and with low vaccination rate. And the CDC also says it's virtually all hospitalizations and death with regards to the Delta variants have been among the unvaccinated. But the CDC released data in July also showed vaccinated people also could transmit the Delta, which officials did not believe to be the case with the other variants. And this led to the agency to make a prompt revision to its masking guidelines. In today's discussion, we will ask questions like, what is the Delta variant? How has Delta changed the pandemic endgame? And what are we doing to protect and indeed pass information to our communities? And how are we going to counter the myth that also are always associated with some of these things? I would like to bring in Mr. Sam Imwangi. Indeed, he is the Executive Director of Global Fatherhood Foundation. And we also have other participants, Dave Johnson. Dave Johnson is actually with the Hennepin County Public Health, as well as Tad. Tad will also be speaking to us as far as this conversation is concerned. And a community leader, Mr. Henry Momanyi, will also be sharing some updates and views as far as the sentiment of the community is concerned. And also Mr. Pewi Besa would also be sharing some information with us, indeed, from the Minnesota Department of Health. So please, you have joined the conversation. Do me a favor, invite your friends, and let's have some understanding and also ask the questions that you may have as far as the Delta variant is concerned. Mr. Imwangi, I'd like to bring you in as my co-host for today. Indeed, in your capacity as the Global Fatherhood Foundation Executive Director, I know there are a lot of things you are hearing and learning. What are some of the questions that we would like to pose right away before we get into the conversation?
Well, before I start, I want to say thank you again for the participants. You're welcome. I know it's going to be a good conversation. We're going to talk about Delta. So for the last couple of weeks, actually for the last few months, we have been very much engaged with Hennepin County and Minnesota Department of Health. We have gone out to the community doing our vaccine outreach and just gathering information and trying to understand basically what's going on. But this has been a new, with the new Delta, there have been so much questions here. For instance, communities that ask you, how is this Delta spreading? Who is being hospitalized here? Another thing, the communities, they are worried. Who's being impacted? Is it the male? Is it the women? And also, do we have data, especially for our immigrants communities, something which can show that this Delta is having an impact on our community? So I'm going to ask that question actually to Dave Johnson here. You can be able to help us maybe understand more and maybe share this information with our community. Thank you.
All right. So, Mr. Dave Johnson, you heard the questions. If you are able to, please do justice to these questions.
I'll give a start, and I'm sure my co-presenters can also jump in and provide additional information. Thank you for having me to this presentation, this forum. I'm happy to provide information to the community. I hope it's going to be a productive discussion. I am the epidemiology manager for Hennepin County Public Health, and I think the message right now that we're trying to promote in the community is that the Delta variant is here. It's surging, and it's different. The Delta variant has quickly grown from less than 1% of cases in May to greater than 95% of our current cases that we're seeing in Hennepin County. And Delta is different from the original type of COVID in some significant ways. For one, we know that Delta is different because this strain can spread more easily from person to person in the community. Another difference is that we recently became aware of how it can act differently in people who are vaccinated. People who are vaccinated continue to be much less likely to become infected with COVID-19 than someone who's unvaccinated. But if they do become vaccinated, we know now that Delta is able to spread from someone who's vaccinated to others. And this means that Delta is challenging us in new ways. We had seen a steady decline as vaccines became widely available through April, May, into June. But since June, we've been on an uptick in COVID in our community, and it's been having an impact as to what we're seeing. And so we need to change our approach to keeping our community safe.
Wow, indeed, we need to change our approach in keeping our community safe. Once again, this is the COVID-19 Delta variant discussion. It's a community engagement and education on the risk factors, and this is brought to you by the Global Fatherhood Foundation, indeed, with support from the Minnesota Department of Health, as well as the Hennepin County, and of course, the Global Health Services. Mr. Mwangi, was the question, do we now move on to the next part, indeed, that is talking about what actually the Delta variant is, or maybe the possible data that is available that the community may know. Do we move on to that for Mr. Johnson as well?
Yes, certainly. I think having data, this can tell a lot about the extent about the spread of the disease. So, Mr. Johnson, if you have any data, that's going to work out fine.
Sure. I can provide some information about what we're seeing in our communities. We're looking at who's being impacted by Delta, as well as the communities that are at greatest risk. And a few things I would say about this. Right now, Delta is widespread in our community. Anytime someone leaves their house and goes into a public place, they're at risk of catching COVID. And that's true of people across our county in Hennepin County. It's true across the state of Minnesota. Delta has been rising and affecting people across communities. We do know that Delta has impacted some communities more than others, as COVID has from the beginning. we see that there are disparities in the rates of COVID, and that there's inequities in who's being impacted. People who identify as being American Indian, as Black or African American, as Hispanic, are at higher, have experienced higher rates of COVID. They've experienced higher rates of hospitalization and higher rates of death than the general population. And so we're really trying to get the word out to people that it's important to take these safety measures of vaccination and masking seriously, and to know that anytime you're outside of your household, that you may be at risk of catching COVID if you've not been vaccinated.
All right. Thank you so very much, Mr. Dave Johnson, indeed, with the Hennepin County Public Health. I would like to bring you in, Tad. I know you'll be taking lead of us at some point. I know the city, because of the variants and the experiences that is taking place within our community, has come out with some guidelines with regard to masking. Are you able to share with us some of these guidelines and what does the community need to know as far as these guidelines are concerned?
So yes, thank you. I'm Todd Berg. I'm the fire chief emergency manager for the city of Brooklyn Center. And back when Delta was first starting to really rise and the community was at a high community transmission rate, our city council passed a ordinance or proclamation stating that masks should be worn indoors in all city buildings and government buildings. So now, whether you're vaccinated or not vaccinated, so that's really the mandate that we have. There are a couple exceptions, obviously, swimming pools and kids under, I believe it's 2 years old. But really, what we really are needing to do and trying to encourage is people to be vaccinated. That's how we're gonna get out of the health crisis that we're in. Is just getting people vaccinated, and
all right.
Yeah.
Okay. All right. Thank you so very much, Todd, for the submission with regards to the masking and indeed the call on more people to get vaccinated. I would like to bring you in, Perry, now. Also, when we look at the broader picture as far as the state is concerned, are you able to share with us the state's mandates on face covering, or is this left to the individual cities to decide? So the question is, there is a federal mandate on masking, but then with regards to the state's level, what is the state's mandate on face covering? Yeah, please, if you can unmute.
Okay, all right then. Thank you very much for inviting me to this great program. And community outreach is basically what our people need at this time in the midst of all of these variants. But just to give a quick disclaimer, I'm not a spokesperson for the Minnesota Department of State, Department of Health. However, I'm actually the supervisor of the vaccination unit with the Minnesota State Department.
Okay, thank you for that.
Yeah, so let me just be quick to state here that, like the previous speaker just said, the mandate for masking is actually been given by Tim Wolf, that everybody needs to mask up because of the variant. The variant is very contagious, like you earlier on stated in your introductory part of your program. The variant is actually not friend of you, is not friend of me, is not friend of anybody. The variant has a lot to do with people who are not vaccinated. So what has been the call every day, every time, everywhere is when you are in a place of public gathering, make sure you mask up. When you are in a place where you see people a lot, you need to mask up. you definitely know that even riding an airplane, you need to mask up. That is federal mandate that everybody needs to mask up in federal buildings and airplanes and in other places. So the state has continued to speak out to the fight that in order to contain this variant and to contain the coronavirus, we need to keep ourselves masked up. The only way we can actually beat down the variant or the virus is also to make sure we get vaccinated. You know, vaccination is a key. If you do take statistical look at what has come up from the state and what has come up from federal, many people who, in fact, 99% of people who are vaccinated do not get affected as much as people who are not vaccinated. People who are not vaccinated are actually a reservoir for this virus to just quickly affect you. So that has been the call of the governor. That has been the call of the vaccination team of MDH, and that has been called by the community organization as well. Think about it on a bigger picture. We have cultural limitations, cultural boundaries. We have mosques. We have churches. I think the message out here should be more to our people to say, hey, you are in a mosque. You need to make sure your congregation is masked up. You are in the church. You need to make sure the church members are masked up. You are having a community program, a party, or wedding ceremony. You need to make sure these guys are masked up. Because one thing you and I do not know is that you cannot walk counting who has been vaccinated. It's not rating on the face.
No way.
So it's difficult to tell who is vaccinated versus who is not vaccinated. So to keep that to yourself, and it is a whole big picture of discussion. Then we come to immunocompromised people who are almost like susceptible to having a virus as quickly as possible. So you don't want to expose yourself. Like I always tell, my colleagues at work, my colleagues out in the field, you are going back home. You have family home. You have kids. You have sisters. You have brothers. You have relatives. What happens if you have the virus? What happened to that chain? What happened to those people? So I mean, it's everybody business. We need to do due diligence to be able to combat this coronavirus and variant in our communities. Right. We need to abide by the fight that we need to wear masks. I know there are limitations, like the fire department here just said, of people who are not to be, to wear masks 2 years and below. Absolutely, people who have a medical problem that indeed they cannot wear masks. We understand that. But if I'm coming to you and you are immune compromised, I wear my mask.
You wear your mask to protect yourself.
Exactly. I'm protecting myself from whatever you have coming to us.
Absolutely. Thank you so very much, Mr. Pewi. I know, Mr. Tad, you may be taking leave of us. Before you go, I would want to take your closing remarks now. Then maybe I can let you go. Then after that, I'm going to bring in Mr. Momayi to really take a community perspective as far as the Delta variant is concerned. Mr. Tad, please.
Yes, just in closing, I think everyone here spoke, the truth and really how we beat this with the masking, with the vaccinations, and really it's everybody's part. We're all one big team to try and beat this monster called COVID. Vaccines are really truly the way out of this. And I understand not everyone can get a vaccine, but the more people that do get it, then we'll be able to ease some of these restrictions hopefully down the road.
Absolutely.
Thank you.
Indeed. Yeah, you're welcome. Thanks so much for joining us, taking time out of your busy schedule, indeed, to talk to us, the community, especially the community of Brooklyn Center. Thank you so very much. We truly, truly appreciate it. Once again, this is African Let's Talk, and we are having a conversation with the Global Fatherhood Foundation together with the Minnesota Department of Health, as well as the Hennepin County, and they are helping us to really dissect into the COVID-19 Delta variant community engagement, conversation, and also education on the risk factors. I would like to bring in Mr. Henry now. We are trying to figure out, indeed, one thing about the Delta is how quickly it spreads around the world and even in our communities. Delta will undoubtedly accelerate the pandemic because we were making progress, then the Delta came. So it's unfortunately having a way to accelerate the pandemic. Mr. Henry Momanyi, through your community engagement and vaccine outreach, are your efforts gaining ground? That is what we want to know. And are there any challenges that you have encountered along the way? And also, can you also share with us how you are able to reach out to the youth?
Well, thank you. Thank you so much, Mr. Beyond, and the rest of my panelists. My name is Henry Momanyi. I am the Executive Director of Global Health Services, and my agency specializes in outreach and early intervention in African immigrant community when it comes to infection and diseases. To answer your question, I am not going to focus on a clinical perspective because my background is not in the clinical, perspective. So mine is from the community, work. So yeah, we have made progress when it comes to COVID-19. So far, we have been having vaccine in the communities around, and there are so many challenges, of course. Not all people have been vaccinated. And I can tell you, the COVID-19 people have not been vaccinated. But again, now here, when we have made some progress, when we have made some steps, here is what? Delta variant. Now, it's like, we are in the twin now, two-way traffic. What are we supposed to market? What are we supposed to tell the people? And then you find people coming up with questions. What are the symptoms of this Delta variant? How is it different from the COVID-19? And even before we answer that, we ask them, but have you been vaccinated with the COVID-19 first? Do you know the symptoms of COVID-19? Or have you been a victim of COVID-19? Some of them, yes. Some of them, no. And then we tell them, if you have never had COVID-19, then it is a different experience. But if you have ever had COVID-19, the symptoms of the Delta variant are kind of, the same, but the gestation period, the Delta variant takes 4 days, but COVID-19 takes 6 days. Actually, Delta variant comes in sooner, and it infects so many people without them realizing what's going on. But again, the challenges which are there is there are so many misinformation outside there. Mm-hmm. And it's kind of, our people are susceptible to negative influence or negative, messaging. We are struggling to get, to the bottom of this. So we are struggling, but we are making some inroads. We are not tiring up. Like Mangi and others said, my agency with other agencies, we normally partner with the MDH, DHS, and Enabling County. We are always outside here every weekend. And we sometimes, try to use our experience on the ground, especially when we have group level intervention and individual level intervention, where you talk one-on-one and you explain the essence, why somebody must get vaccinated. And when it comes now to group level intervention is when you go where people gather, like parks, like churches, like, wherever they're having a barbecue. And then you start, slowly you bring in, what you want to know, you see. Because the kind of behavior they exhibit there is worrying because they are too close, they are congested, they don't even wear the mask, you see. And then that's when you get an opportunity, when you get like airtime of 5 minutes, you talk about the Delta variants and the COVID-19 variant. But again, like I said, we have been trying to do, our best. Mm-hmm. Resources are there. I can say there are so many resources. But again, kind of the challenges we normally get is the response from the community.
The response from the community. Thank you so much for the submission. Now we're going to take just a quick break and we'll come back. Of course, based on our survey, there are some questions that would definitely need Mr. Dave Johnson to help answers to help answer those questions. But for now, let's take a quick break and we will be right back.
You are probably hearing a lot of information about COVID-19 vaccines right now. We wanted to answer some common questions about how COVID-19 vaccines are being made. How are COVID-19 vaccines being made faster? Usually, testing a vaccine to make sure it's safe and works is done before large amounts of vaccine are made. Because of the pandemic and money from the federal government, scientists are doing both at the same time. Only vaccines that have been tested and are shown to be safe will be used. How are vaccines being tested? There are several different COVID-19 vaccines in testing. These tests are called clinical trials. Each vaccine goes through more than one test. First, the vaccine is tested with a small group of volunteers, then a couple hundred, then tens of thousands of people. Volunteers for COVID-19 vaccine trials come from many diverse communities and backgrounds. This is the same process used for testing other vaccines. How will vaccines get approved? For the vaccines that make it past all the tests, a team of medical experts will look at test results and how people felt after they got the vaccine. If the vaccine works and it's safe, it gets approved.
All right, indeed. And if the vaccine works and it's safe and it gets approved, we'll definitely bring back the completing message as far as this information or this communication about the vaccine is concerned. But I quickly want to come to you, Mr. Dave Johnson. There are a couple of questions that came from our survey from the public, indeed, with regards to this conversation. For example, people want to know, has Delta actually changed the pandemic endgame? And also, there's always that contention about how likely is one to get COVID-19 twice. And so these are some of the things. For example, there's also the thing about how does reinfection mean for COVID-19? So if you're able to please tackle any of these questions for us.
Sure, I'll take a stab at it. The first question you asked was, how does Delta change the pandemic endgame? And really, I think we've known that viruses mutate for some time. We know that with other viruses. It's a common feature of viruses that they do mutate. And when the way they mutate by replicating inside of people. So as long as people continue to get infected with COVID and have that virus replicate inside of them, we can see new types of mutants emerging. And that's something that we just see. It's a matter of science that we know that viruses do this. They're very good at it. And so what Delta has reminded us is that a variant can sometimes be more effective. It can also perhaps elude our defenses a little bit more readily. And that's what we're seeing with Delta right now. So that's really the end game of this. I think, like Mr. Berg and others have said, is the vaccine is so important, because if you have the vaccine, you're much less likely to get the virus inside of you. And if the virus can't get inside of you because it's blocked by the vaccine, then we don't see that mutation possibility as much. And so we need more and more people to take the step to get vaccinated. We're not at the level that we want to yet. And there's some people who can't be vaccinated yet now, the young, those under 12. So the other question you asked, now I'm saluting
it's how likely is anyone to get COVID-19 twice?
Thank you. Thank you for reminding me. Yes, the possibility of reinfection. Yes. It is possible to be reinfected with COVID. We've seen cases where that has indeed happened. It's not particularly likely at this point, but really we're still learning so much about this virus that what we know today is going to be very different than what we're going to know 2 years, 5 years down the road. So I think for someone who has been infected with COVID, the vaccine does provide additional protection to them. We know that, and we know that. So people who have been infected should still get the vaccine. They should not count on that immunity that may have been conferred by the virus alone. You'll have much more protection if you take that next step and get vaccinated. So again, we want vaccination for everyone who's able to be vaccinated at this time, regardless of whether they've been infected or not in the past.
All right. Thank you so very much for actually doing justice to these questions from the audience through our survey. I would like to come to you, Mr. Perry, now. The area about older folks who get vaccinated, and of course those who are younger and unvaccinated may also be at risk of getting COVID-19. Some experts actually say in Minnesota we are actually in a good position somehow because of its relatively high vaccination rates, or that conquering the Delta variant will take a race now between vaccination rates and the variant. So, but if Delta, for example, keeps moving fast, multiplying infections in the US, Mr. Perry, can you give us the Minnesota Department, or probably from your outreach efforts, what's the outreach effort are you making, and your leadership and your team is making actually towards making sure that the Delta variant actually is controlled, and also the African community is supported? They want to know the kind of support that is coming towards the African community with regards to education.
Thank you. Just quickly, let me piggyback on the question before this, then I will quickly run through the two questions. But be very quick to say that we are concerned about the rise of all variants in Minnesota. Let's be very clear here. It's not only the Delta variant that we have in Minnesota. So there are variants, that's spreading all over here. So the predominant strain in Minnesota is the Alpha variant. So they have another variant they call the Alpha variant. But we are also seeing increase in other variants, right? So such as the Gamma variant. We have another variant called the Gamma variant. I
didn't know about these.
Yeah, so we also have, but for the most part, the Delta variant and other variants, right? We've seen that the cluster of these variants or these cases in different parts of the state has continued to actually evolve. This will continue to happen if people have not received their vaccination, all right, or do not take serious the steps they need to take to be able to be vaccinated. We are seeing the higher rate of severe disease or hospitalization basically in people who are not vaccinated. I said that earlier on. More than 99.9% of new cases, hospitalizations, and deaths, regardless of strains, are in unvaccinated Minnesotans. Wow. So that's something we need to take very important. And there are emerging evidence that all of the available COVID-19 vaccine provided protects against the COVID-19 variant, including the Delta variant.
Wow.
So it is important that our community gets to get educated. So you talk about, the difference here with the variant is people who are vaccinated will definitely get affected with the virus, like our colleague just said, shortly. However, the difference is that people who are vaccinated, most times they're not hospitalized. They don't see death. I mean, they are mild symptoms and whatsoever, unlike people who did not get vaccinated. 99% of people who did not get vaccinated are hospitalized, receive deaths, and all that. So our point of cohesion here to make sure that our community gets educated is to appeal to them, to ask them, to educate them the importance of them taking the vaccination. The only way forward in beating back whatever variants we have in Minnesota is to get vaccinated. Right. It is almost wherein he said the only way you can have in those days when they had wars, people used to fight war. The only way they could actually capture or defend their community against the warriors that are coming to fight them is to build fences that will block people from coming there.
Absolutely.
For us, that fence is the vaccination.
Mm-hmm.
If we get vaccinated and you encourage your brother, your sister, your mother, your daughter, your father to get vaccinated, you are vaccinating, in other words, thousands of people who might have just transmitted this virus to other people. So the community engagement has been tremendous. So if you see that MDH is partnering with a lot of CCTC organizations,
mm-hmm.
we have tons and thousands of clinics that we put up every week. I've worked for the past 7 days making sure that clinics are actually run to be able to provide people vaccination. I spent a couple of days, over 5 days, to the state fair, making sure that people at the state fair who are going out there to get vaccinated. That's our outreach. I think it is important for all of us to encourage our neighbors, our brothers, our sisters to get involved in just, in our culture. Africans in general, we normally solve problems in the kitchen, in a palm touch kitchen, or somewhere behind the house, or somewhere at the waterside, or somewhere that somebody can listen to you.
Right.
That's what we need to do. Let's put this whole American syndrome on one side and understand that our health comes number one. I think if we all get to know that, definitely our children, our brothers, our sisters will definitely live a healthy life.
Wow, thank you so very much indeed. You have, they will say you have nailed it where exactly it has to be. And thanks so much for being so passionate about the work and as far as the outreach is concerned. And I believe the community is listening and knowing, especially with the facts available and the data available, that those who are unvaccinated are more than likely to really get the COVID now as compared to those who are vaccinated. So, of course, the fact is very clear and bare for anybody to know. Mr. Mwangi, I'd like to bring
before he comes in, I just want to share one quick story. And Mwangu and I were somewhere in the north 3 hours from here a couple of weeks ago. And I walked to somebody to say, hey, we are here to provide vaccination for you. We need to be vaccinated. One of the things that we all need to speak to our community to change is the myth. The myth is not okay.
Right.
And the guy looked at me, he's like, look, Pee-wee, what did you come here for? You left 3 hours from Minnesota you came all the way here to turn me into zombie?
Oh.
No, I'm not going to turn you into zombie. I'm not here to turn you to zombie because the myth. I know social media is all over the place. People have a lot of things on social media. People have a lot of things everywhere on our internet. We need to read between the lines and be able to discern the better for ourselves.
Indeed. Indeed, it's very important. That is why some of these community engagement through diverse and trusted media is so important, so that people can differentiate between the myth out there and also what is coming from the experts who are speaking to the issue. Mr. Mwangi, I'd like to bring you in if you have any comments so far, but even before you come in, Ida Simon says, Mwangi, vaccine warrior. Thanks for all that you do for your community. And indeed, I would also say that my panelists are all vaccine warriors. So thank you, panelists, for all that you do for the community. Mr. Mwangi, please, if any comments now before we get to the concluding version of tonight's discussion.
Well, thank you. Thank you so much, Ida Simon from Worthington. I remember I met you, I think it was like 3 weeks ago. I was there with Mr. Bai Pee-wee, and we really had a good, we had a good time, actually. But the most important thing I want to say about the conversation is community engagement. We don't need to stop. We need to keep on fighting. Like Henry said, there are still people who are not vaccinated in our community. When you hear somebody is sick, somebody in the hospital, people are dying, I get worried. Men, fathers, and youth. Remember also, there was a time I was sharing about, we have a huge number of 13 years old, of 11 years old, who's going to be turning 12 years old. So we are going to reach out to our parents again and say, these kids, they need to be vaccinated. Remember, this week we just opened schools, some of the schools in Minnesota, and going to schools and mixing up these kids with those ones who are not vaccinated, there's a high risk A high risk, somebody to get sick, somebody to get the virus. So we need to keep on pushing. We need to keep on pushing. Again, we have our older parents, our folks there. Some of them they're worried. They're worried because of they don't have the correct information about the vaccine. Some they tell me this is water. They're putting water into my body. They're doing research into my body, and this is not the case. We need to stand up. I wanted to reach out to all the leaders who are there, our faith leaders, our community leaders, our teachers, everybody. Let's stand up, like Mr. Piwi had said, so that this virus can go away. Because I want to wake up in the morning, not to get a phone call and being told, Mr. Mwangi, so and so has passed away. I want to wake up in the morning to know that everybody in my community is safe. And
indeed,
again, Mr. Henry, and Mr. Piwi, like in my engagement, how we are doing, we're engaging our youth. It does not make sense to go and fight and talk about the vaccine or do my outreach if I don't engage the youth. We have come up with a youth group whereby we go with them because we want them to be engaged. We want them to see how we're doing. We want people who look like them, who can come and look at these kids and say, you know what, I want to get the vaccine also because they want to be safe. Thank you.
Wow. Thank you so very much, Mr. Mwangi, for the passion, for the work, and also for all that you continue to do as far as education to our community is concerned. Like I said, we are coming to the concluding end of the program, but Mr. Dave Johnson, I would like to take your closing remarks even before we go. And of course, if you also want to touch on the myth and how we can work to really eradicate or indeed lower the rate of the myths.
Yes. Thank you for that. And I totally agree with what's been said about disinformation. We have a pandemic that is a threat to our health, but disinformation has been declared a public health threat as well by the U.S. Surgeon General. And because it's leading to disparities in health, it's causing some groups of people to be less likely to take the measures that we know to be protective in communities. And so I think that people need to learn how to identify misinformation. They need to avoid sharing misinformation, particularly on social media. And you need to look for the source of information. And if that information is being repeated by other credible sources, you need to engage with your friends and family on the problem and point out when you think you've heard something that might not be correct. That doesn't mean you should judge people for sharing misinformation. I think people share misinformation for all kinds of reasons. But we need to support people sharing credible information in our communities in order to beat back this virus, because it's really become a major threat. And I would just say, in my closing remarks, in hospitals across this country, we see that COVID units are filling up with patients. The vast majority of those people filling up the COVID units are unvaccinated. There are still almost 2.5 million people in Minnesota who've not yet been vaccinated. A lot of them are the younger folks, those under 12 who can't yet be vaccinated. But we have a lot of people who are eligible right now who could be vaccinated today. Some people might think I can wait out this pandemic. And Delta has showed us that waiting out this pandemic is not safe unless you're vaccinated. Other people think if I get infected, I can just go to the hospital and get treated. And if you get COVID, though, there's no guarantee that the hospital will be able to treat your disease. And in some parts of the country, there's no guarantee that there will even be a hospital bed for you. So if you haven't yet, please get vaccinated. If you have been, thank you. And thank you for doing your part to keep yourself safe, to keep your family safe and your community safe. Getting vaccinated helps us all be safe together again.
All right, indeed. Getting vaccinated will help all of us to be safe together again. We'll just take another quick break, and when we come, we'll finalize all the discussion, and then we'll definitely bring it to a close. But for now, please stick and stay, and we will be right back.
Hi, my name is Khair Musa, and today I got the vaccine, and I'm 13. And today I got the vaccine because I want to make the world a better place. And I want to make this place safe, and I want me and my family to be safe, and we want it to be free with COVID, and everything could go back to normal and how it was before. Please take your vaccine so everyone could be healthy.
All right, it's been summed up nicely. Please take your vaccine so that anyone, and of course everyone, can be healthy. Thank you so very much, my dear panelists. Mr. Pewi, I would let you come in 30 seconds, your closing remarks. Then I will come to you, Mr. Henry. Then finally, Mr. Mwangi, if you also like to chip in with your final closing remarks.
Thank you again. My closing remark basically have to do with the fact that the Delta variant could be catastrophic in many communities, in our communities. It would not be catastrophic if we took measures to stop it. And that measure is to be vaccinated. Many unvaccinated people with COVID-19, many times people who have been out in the community and got the variant or got the coronavirus. One thing they will tell you is, "Oh my God, I wish I had gotten the vaccine."
True.
I wish I had gotten the vaccine. So it is important that if you choose not to get a vaccine, make sure you wear masks. Mask up for the people who are just walking next to you, people who are just with you in the next community. I want us to be very, very careful that the Delta variant is currently the most prominent strain of COVID-19. However, and remember this, the Lambda, there's a variant that's coming from South Africa. They call the Lambda variant. We don't know what that's going to cause for us in America. But let's deal with the one we have here now to get vaccinated against these foes that are trying to wipe out many of our communities. And Mr. Omorgi just hit a certain point I really like, that I don't want to get up in the morning. I must tell you, I have lost over 5 members of my family.
Wow.
I don't want to get up in the morning and hear somebody calls me and say, "Oh, this person has died," or "My sister person has died." It is an excruciating pain to hear when you get up to know that somebody would have died from something that it will prevent. We just have prevented by taking the vaccination. I think it is great that we're all doing this to have community informed about our stance. And I want to be appreciative to all of you guys for the time in getting out there to make sure speak to people. My slogan, as always said, when I'm at MDH, is that each one talk to one. Each one talk to one.
Each one talk
Each
to
one
one.
talk to one. At the end of the day, the community will be told about this entire coronavirus. Thank you very much for having me.
Absolutely. Thank you very much. And also so sorry to hear of even the experience of losing family members, up to 5. That is quite worrying and also very critical. But we appreciate that you share this with us to encourage people that we don't even need to lose 1, let alone 5 family members, especially when we have the chance to take the vaccine or to encourage the others to do so. Mr. Henry Momanyi, please, for 30 seconds. I know I gave more than 30 seconds to Pewi, but for 30 seconds, please, can you give us your closing remarks? Oh, please, you're on mute. If you can unmute yourself. Okay, I think you are good. Yeah,
Am I good?
Yes.
Oh, all right. Yeah, thank you so much, Mr. Beyond. And first and foremost, I want to thank our faith-based readers in our community. That is the pastors and the elders of the various churches that we work with. These guys have given us a very, they have given us some motivation because they have supported us and they have said the doors are open 24/7. Actually, they are allowing us to have these vaccine events even when there's someone going on, so that they can capture those people who may not be, available when we do the vaccines outside there. So I don't want to take it for granted. I want to say that, thank you so much for rising up for the community. Wherever you are, we want to make sure that you know that, we acknowledge what you are doing in the community. Number 2, they say prevention is better than cure. That's the bottom line. Prevention is better than cure. If you can say what my friend B or Biasa said, I'm sorry, Dave Johnson said.
Dave Johnson, yes.
Yes. In all the people who are now infected in hospitals, 99% of those people are what? Unvaccinated. And the majority of the deaths we are experiencing now are what? People who have never had what? The
vaccine.
The bottom line is there's no shortcut. Please take your time, and I want to request all households, parents, teachers, all stakeholders. We are the parents, we are the teachers, we are everything. Please make sure that in that small organization, in that small house of yours, everybody who has reached the age of 12 and above is vaccinated. That's where the fight starts from.
Indeed.
Because it is needless for me to come out and start talking about vaccination or being vaccinated if in my own yard people are not vaccinated.
Right.
Sense. Number two, I want also to thank the big, institutions like MDH, DHS, and Edmund County for the support they are giving us. Like now, we are having a challenge again of, the gift cards that they were giving us for the $100. Now, those gift cards are not there. We are having a big problem when we are doing these people. They say, yeah, I'm coming. Where is my gift card? You see, these are the things that we are now, the challenges, small challenges that we are meeting on the way. But we want to say, I know, wherever they are listening, we are there, support us, and also, there is a big problem, and I have not heard anybody saying it or talking about it, about sterilization. Most of the ladies that I'm, talking to, they are hesitant. They don't want to take this because maybe of those misinformation. And, some of us, we are not doctors. We tell them, just come. The doctors are the ones who are administering the vaccine. Come and talk.
Right.
You see. But again, that's where we are getting the challenge. And most of these ladies talking about the sterilization. In fact, they are not at the age of giving parts. I don't know why they are not. So we would want the doctors to tell us about it.
Okay.
But the most important thing is,
okay.
Thank you so much for this opportunity. And let's keep on, doing this job because there are so many people outside there who have not been vaccinated. Thank you very much.
Yes, you're welcome very much, Mr. Henry Momanyi, and I believe that the conversation will continue so that even the lingering questions about people, especially women who feel it has anything to do with their fertility could be answered. And as Narte says, a great discussion, education is the key. Mr. Mwangi, please, our time is far spent. Can you share with us your final concluding remarks? Then we can end the program at this point.
Well, just on behalf of the Global Fatherhood Foundation, I want to say thank you again, Mr. Beyond, even co-hosting this event with us. This was a pop-up which came out, and we wanted to do this before the kids go back to school, but they went to school. We couldn't do it last week because I was on vacation.
Right.
Mr. Momanyi, thank you. Dave Johnson, thank you. Mr. Piwi, thank you. Meeting up with Worthington, I think we connected. What I want to say is this. I know there's so much unknown about these viruses. I know every day it's a learning experience. And this is, we want what I want to reach out and say this will be an ongoing conversation. Let us continue engage more people. Let's continue engage our networks, our faith leaders, our students, our school, our teachers, our politicians. Let's all come together because this disease is mutating. And you know what, like I said, you don't want to wake up in the morning and told somebody's sick. Finally, I want to say about just three things, and very, very important. Let's continue wearing masks. Let's practice those social distance and just wash your hands. Just very, very basic things from the CSDC guidelines. And lastly, let's have another conversation again. Thank you again.
Absolutely. We will indeed have another conversation, and all the other questions would definitely also tackle them, and any other concerns or feedback will also bring them forth to you. Once again, thank you, gentlemen, for being on the program indeed to talk about the COVID-19 Delta variant, the community engagements as we are doing, and also learning about or educating the public or the community on the risk factors. I truly appreciate your time. Thank you.
Thank you very much.
Thank you.
Right.
Thank you for the opportunity. Thank you.
Absolutely. Absolutely. All right. So this has been an amazing discussion. And please, if you want, what we want you to do from now on is to continue to share the video, invite your friends to actually see it. And you have any comments or feedback or even more questions that may be lingering on your mind, then you can always reach out to the Global Fatherhood Foundation, and they will definitely help you to get the right resources in answering all the questions that you have. But I just want to end with the video, the short 30 seconds video from the 14-year-old student who is taking the vaccine, and her conversation or her message to the entire community.
Hi, my name is Khair Musa, and today I got the vaccine. And I'm 13, and today I got the vaccine because I want to make the world a better place, and I want to make this place safe, and I want me and my family to be safe, and we want it to be free with COVID, and everything could go back to normal and how it was before. Please take your vaccine so everyone could be healthy.
My name is Adi Penyaganda. I am a social studies teacher at Apple Valley High School, and today I want to encourage parents across the state of Minnesota to get your kids vaccinated as soon as possible against COVID-19.
Teaching through this pandemic has been quite a challenge.
I work with a lot of young children who aren't eligible for vaccines yet, so I really would like to encourage adults and older children to get vaccinated to keep our children safe.
If we want to have a chance at a normal school year, we need to create classrooms that are safe and buildings where students don't have to worry about their health.
The vaccination will allow us to move back into our building with more safety, less risk, and overall less fear.
The school year starts in just a few weeks, and the COVID vaccine, as we all know, takes a couple of weeks to get to that fully effective state. So they'll be fully protected by the time the school year starts.
And I encourage all students to get vaccinated as soon as possible so that we can have a great school year in 2021.
Have a great year. Much success to all educators out there. Much success to all young people out there. Let's make it happen.